Maybe I start with some things that may not be widely known about the U.S. system. One is that we don't have a predominantly privately funded healthcare system. So while the official statistics say that about 45% of our health expenditures are government funded, in fact, if you do a comprehensive analysis of where our funding of our healthcare system comes from, the number is closer to 66%, which is not very different from that in Canada. So that 66% reflects not just the public insurance programs that we have, so our Medicare program, which is for the elderly and some of the disabled in the U.S., and Medicaid, which is for some of the poor, are what's usual, and our veterans system are what's usually tabulated as public expenditures, but they don't include the public expenditures for public employees insurance. So government buys private insurance for most public employees, and that in fact is about 1/4 of the total private insurance market paid for by employers. So, you know, when President Trump has his insurance paid for by government, we think that's a government program. And the second is that we have very large public subsidies for private insurance purchase in the U.S. because if your employer buys coverage for you or contributes to your private coverage, that's not considered part of your wages and you don't pay taxes on it. And in fact, our federal budget documents classify those tax subsidies as a tax expenditure in our federal budget. And this past year, that was about $300 billion in the federal budget, and somewhat more on top of that in state and local tax subsidies, because you don't, you know, if my employer pays for $10,000 worth of health insurance for me, I pay no taxes on that. If they give me $10,000 in wages, I would pay about half of that in taxes. And it's a very substantial addition. So including those two things, about 2/3 of our expenditures are government expenditures in the U.S. And on a per capita basis, our government expenditures are in fact considerably more than the total expenditures for healthcare in Canada, both public and private combined. And in fact, more than the total expenditures on healthcare in any nation except Switzerland, so far as we can tell. So Switzerland has the second most expensive healthcare system. This is all on a per person, per capita basis. U.S. spends about $6,500 per person in government money on healthcare, and that's more than any nation except Switzerland spends on its entire healthcare system. So we have not just a very copious expenditure, but also a very high level of government spending, and yet, as I think is widely known, we have large numbers of people who don't get the care they need and are severely stressed when they do get